Hello, students. I am going to go through your homework. I have looked through everybody's homework, so I know different things to tell you to look for. So let's start off here with number one. It's a T code. Remember, poisoning. Poisoning is always sequenced first, okay? So we have the poisoning code first, and then after that, you list what's wrong with the patient. So we have the gait, we have nausea with vomiting, other visual disturbances. We have HIV disease listed. I had a few students put B20 first, but the reason we don't on this example is because the poisoning is not related to HIV. Keep that in mind. So that's why HIV is listed down secondary. Then we have epilepsy, and then we have our S code for injury, and then person injured in a motor vehicle accident. Let's move on to number three. Now, this one's an adverse effect, and I've always talked about that. When you have an adverse effect, you list what is wrong with the patient, and that is the L50.0, the allergic urticaria. And then you have the adverse effect code. We need the malignant neoplasm of the testes code. And one thing I'm noticing, students, is that you are not coding out the procedure. This is very important. So we have excision of the right lower arm skin. I do have all the answers in case you want to check them. Okay, now this one here, when we talk about HIV, the histoplasmosis is stated as the current problem. Keep in mind, it is related to the patient's AIDS, I'm sorry. So that means AIDS has to be the principal diagnosis because this is related to it. I always give an example too, like let's say a patient has AIDS and they fracture their tibia fibula. The tibia fibula is principal diagnosis because AIDS is not related to that. So here, this diagnosis is related to AIDS, so that is AIDS is principal diagnosis. We also have our other drug induced. We have adverse effect, which is our T code, and then our procedure code, insertion of insulin device. Let's move to 7. One thing that's really important with number 7, we have all these different drugs. Okay, they all needed to be coded out separately and they need to be listed first. I don't really care which one's first, but they all need to be listed out separately. And then we have acute respiratory failure, respiratory ventilation, and then insert of the trach. Make sure you read through this because this will help you also because I have a lot to go through. Number 9, we have nausea and vomiting, and we have an adverse effect. So the nausea and vomiting comes first with the adverse effects second. Number 11, same thing, adverse effect. Always comes secondary. Acute embolisms first, and then this B code here is an x-ray. You do not have to code x-rays. If you do, that's great. I tell students in ICD-10 CM, PCS, that procedures that are non-invasive, the charge master will pick those up. So any x-rays, non-invasive CAT scans, things like that, you do not have to code, but you can if you want. 13, poisoning, so that T codes first. We have another poisoning, toxic effect, and then our alcohol abuse is last. 15, we have fracture of the patella, and then we have our activity codes, nausea and vomiting. Make sure you don't list symptom codes as your principal diagnosis. And then we have our reposition code. All right, so now I'm going to move on to chapter 21. First code should be a T code, kidney transplant rejection, and then excision of the left kidney. Then number 2, we have dislocation of the internal left hip prosthesis, initial encounter, T code. we have anemia, revision of the hip joint itself, and then transfusion of RBC into the peripheral vein. Number 3, we have quite a bit going on here. We have infection, mechanical loosening, long-term use of anticoagulants, and then you can see, look at all these procedure codes. We have removal, but then they have to replace it. Then they're doing excision of the left tibia, and then excision of the left fibula, both open approaches. And you don't have to have the F code if you didn't put that. Okay, then we go to 4, inflammatory conditions of the jaws, personal history of malignant neoplasm of the tongue, radiological procedure radiotherapy is a cause of abnormal reaction, and excision of the left mandible. Number 5, acute pulmonary insufficiency following non-thoracic surgery. So we have a J9 5.2, and we have to code our malignant neoplasm and then our excision code. Then number 6, displacement of the bile duct prosthesis. We have malignant neoplasm of the head of the pancreas. So if anybody has any questions, I do have the answers. They will be attached to your assignment. Make sure you view them. This is very important, especially when we get in the test. I can always tell students that listen to my videos, especially with sequencing of adverse effects and poisoning. It will be so important for the exam. Best of luck, and let me know if you have any questions.